culturally diverse, economically dynamic, and demographically young. This is South Asia, home to a quarter of the world's population. Almost 2 billion people reside in the region, making it the most populous area on the world map. Today, most countries in this region are experiencing a new and deadly surge of the novel coronavirus. South Asia now accounts for half of all new known infections globally. Mortality in the region is rising sharply. According to UNICEF, every second more than 3 new cases are recorded. More than 3 people are dying every minute due to COVID-19. Health systems are on the brink of collapse. Hospitals are overwhelmed. And there is an acute lack of oxygen and other life-saving medical supplies. The speed of the virus is outstripping these countries' ability to treat and save lives. While India is in the midst of a major coronavirus wave, its neighboring countries too are battling rising infection rates. A third wave and the spread of new variants of the virus remain a threat. But coronavirus vaccines provide a glimmer of hope. So, how are COVID-19 vaccine rollout plans unfolding in these countries? How are these countries fighting the Wuhan virus? What is the big picture? In this show, we bring you on-the-ground reports from 4 major countries of the region. A land of 1.37 billion people, India reported 13.9 million infections between April 1st and May 21st. Staggering, isn't it?
India appeared to be weathering the pandemic in 2020. COVID-19 case numbers started to fall in September last fall, but they started to rise again in March. And by April, India was caught in the throes of another ferocious wave of coronavirus. India even surpassed the United States in reporting the largest single-day tally of coronavirus infections.
On May 1st, India recorded the highest ever 401,993 new coronavirus cases. While it is not entirely clear why this deadly surge has happened in India, it is likely due to mutations in the virus, as well as mass gatherings.
This deadly second wave devastated the national capital, New Delhi, from where I am reporting, and the financial hub, Mumbai. It affected other big cities and is spreading fast through rural areas. And the fatality rate is going up by the day.
Let's look at some statistics. By May 24th, the active cases had reduced to 27,20,716, comprising 10.17% of the total infections, while the national COVID-19 recovery rate has improved to 88.69%. Karnataka, Maharashtra, Tamil Nadu, Kerala, Andhra Pradesh, West Bengal, Rajasthan and Odisha cumulatively account for 71.62% of India's total active cases. While the coronavirus infection rate appears to be declining somewhat, another disease linked to COVID started spreading across India, the black fungus.
हमारी इस लड़ाई में अभी इन दिनों ब्लैक फंगस की एक और नई चुनौती भी सामने आई है। इससे निपटने के लिए जरूरी सावधानी और व्यवस्था पर ध्यान देना जरूरी है।
So far, approximately 9,000 cases of mucormycosis or black fungus have been reported in India. It is important to note that mucormycosis was present in India before the pandemic, But recently, thousands of cases have been reported from those who have recovered from COVID-19.
The fungal infection preys on patients with weakened immune systems. It is believed that it may be triggered by the use of steroids, a life-saving treatment for critically ill COVID-19 patients. It spreads through the respiratory tract and erodes facial structures. Sometimes doctors have to surgically remove the eye to stop the infection from reaching the brain. Maharashtra tops the list among affected states with 2,000 black fungus cases. Mass vaccination is the only way to win the battle against COVID-19.
Covishield, Covaxin, and now Russia's Sputnik V.
India is vaccinating everyone who is 18 years and above across all states.
I have come to the BLK hospital in central Delhi to see what the Indian vaccination drive looks like on the ground. I've booked an appointment for my first jab of the Covishield vaccine in one of the largest vaccination centers in the national capital region. Let's take a look at what this process looks like.
The staff check your temperature when entering to make sure no one with COVID symptoms gets it. The people entering are separated from the people exiting by a divider, and efforts are in place to keep people socially distanced as much as possible. After queuing for a billing token, I had to wait for my turn to pay for the vaccine, and the waiting areas are set up in several separated sites. The capacity of this vaccination center at Radha Swami Satsang is impressive.
So I'm at the vaccination center now, and my token number for the billing is over 200. It's currently at 135 or so. And well, there's hundreds of people here waiting for their turn to make the payment. Then there are about 40 different vaccination booths. It's a bit of a time-consuming process. I recommend, if you're going to do it, to bring a battery pack for your phone so that you have some kind of entertainment while waiting. The good thing about this center is that there is a cafe or a little canteen where you can get snacks, some drinks, and a bit of refreshment, so you might not need to bring a water bottle, although that's recommended as well.
The vaccination drive for 18 and above in India began on May 1st, and as many as 17 states have announced free-of-cost vaccine to facilitate the process of inoculation. I have opted for a paid vaccine. The tokens are called out by loudspeaker, and upon hearing my token number, I proceed to pay for the jab, which costs 900 rupees at this center. The staff verify the ID, phone number, and booking details before accepting the payment. Then I can proceed to one of the 40 booths set up for the inoculations. Rather than rushing through with the inoculation, this doctor checked to see if I have any allergies or if I had had any adverse reactions to vaccines in the past before giving me the jab. She also advised me not to drink or smoke for at least a week and to return after 3 months for my second dose. After getting your shot, there is a waiting area where everyone who has received the vaccine has to sit down for a mandatory 30 minutes, where they are kept under observation. I decided to try the goodies in the canteen while waiting. Having this small cafe here is a bonus. I haven't seen anyone complaining about any side effects. The final step left is to register at the counter when the time is up. The staff note down the phone number that is registered to Arogya Setu, India's contact tracing digital service, and I am good to go.
Well, that is it. Got my registration done, verified, and out of here. So, they were saying that about 2 hours after finishing the verification, after waiting for 30 minutes after the vaccine, I will get an SMS with the certificate of having taken the vaccine.
It's very good, and I will urge everyone to get vaccinated. There are lots of rumors going around. Unnecessary. I think everyone should get vaccinated.
That is it. Process completed. All in all, it took me about 2-3 hours. I had to wait for about an hour, hour and a half before I was given the vaccine. Then I had to wait for a period of half an hour after taking the vaccine as under observation to see if I would have any adverse effect. Luckily, I'm feeling fine. No side effects as of yet. And this is what the vaccination drive looks like in India's national capital region.
Though vaccine shortages have marred the country's fight against the pandemic, in some places the concept of drive-in vaccination facilities is also catching on. Mumbai was the first city to get the country's first drive-in vaccination facility. It was made to cater specifically to senior citizens and specially abled people. The facility can inoculate 5,000 beneficiaries per day across 7 booths, of which 2 have been reserved for drive-ins. Other cities like Panchkula in Haryana, Noida in Uttar Pradesh and Bhopal in Madhya Pradesh too have started drive-in vaccination facilities.
This is the drive-in vaccination site, which has been set up in Sector 18 in Noida. This is for the second dose of Covaxin for age 45 years and above.
They can come in and wait in their cars and get vaccinated over here. That is also an easy job.
It is much better than being elsewhere where you have to wait in the outside the area of a hospital or a dispensary.
This is great. It makes things much more convenient. Instead of standing, you're still in your car. You can have the comfort of air conditioning in the seat. So I think it's a great thing.
Mass testing, mass vaccinations and masks can help India beat the pandemic. Meanwhile, in the wake of the second wave, India's Council of Medical Research has also approved India's first home test kit for COVID-19. This means that Indians will no longer have to wait for days to receive their test results, and standing in long queues for a swab test will soon become a thing of the past.
The self-use test can be used by symptomatic individuals and immediate contacts of confirmed cases, as per ICMR guidelines. Users of this test will not need sample collection by a healthcare professional. This will ease pressure on overburdened labs and reduce delays in testing. India is the world's largest vaccine producer. As part of its Vaccine Maitri program for the neighborhood, India was exporting vaccines to countries like Bangladesh, Nepal and Sri Lanka. But faced with this catastrophic second wave of COVID-19, it was forced to pause the exports. This has hit many of its neighbors hard. Bangladesh saw coronavirus infections rising from early March 2021. The South Asian country's COVID vaccination efforts have been hit hard in recent weeks.
There is an amendment between the Beximco and Serum Institute of India regarding the Oxford AstraZeneca vaccine. But there is a great crisis in India where they are not getting their vaccine for their people only. So there is a problem. So our government is trying to get the vaccine from different sources, Russian, Chinese, even other also.
Bangladesh is now struggling to procure Oxford AstraZeneca vaccines from alternative sources. Estimates indicate that the current stocks do not cover the second doses of 1.5 million people who have received their first Oxford AstraZeneca jab. The country had earlier signed a deal with India to purchase 30 million doses of the Oxford AstraZeneca vaccine, manufactured by the Serum Institute of India. It has so far gotten only 7 million in 2 installments, as well as a gift from India of 3.2 million doses.
In addition to getting vaccines from India, the government is making strong diplomatic efforts to get the cooperation of China, Russia or the United States. But still, it is a fairly long process. The common people is quite worried. Doctors are also repeatedly urging the government to meet the shortage.
This is the 250-bedded TB hospital at Chiamoli in Dhaka. Named as the first one-stop service center for tuberculosis patients in Bangladesh. This hospital is currently a vaccination center for COVID-19.
We have completed first dose in our hospital, 12,395, and second dose completed 10,555.
Till now, Bangladesh has been able to fully vaccinate 2.4% of its population.
I'm a very lucky person because I could manage myself to have the second dose, and I'm really thankful to the Bangladesh government.
Worldwide, school closures have been one of the most visible means by which the pandemic is affecting children. In Bangladesh, around 42 million children continue to be affected by this, leaving students with little choice but to rely on remote learning. However, not all students have access to digital technology. In many cases, students find virtual classes falling short of their expectations and learning needs.
Although the government has started taking online classes, it hasn't been able to provide 100% internet service in remote areas. The cost of internet is also a big fact. The government didn't provide any subsidy in this sector.
Meet Nazifa Saman, a student of Class 8. She is annoyed and frustrated with the online learning process. Nafisa is tired of sitting at home and wants to go back to school.
I miss my friends, teachers. They are always help us in my studies. But in this Zoom meeting or Facebook online classes, I can't very much attentively, and it is always buffering. That's why I can't study much attentively.
Students are not the only ones having to adapt. Teachers, too, are having a hard time. Rajaram Paul Chowdhury is an English teacher at Gulshan Model High School and College in Dhaka. The school has been shut since the lockdown was announced, so he, along with his students, shifted to a virtual mode of teaching and learning. But for him, the pandemic has changed his life, both economically and socially.
After pandemic, it is very hard for the teachers, me also, to maintain the family. You know, maintain the family in the urban areas, it is very difficult. So we are not getting any school or institutions salary because students are unable to attend the class and they are unable to pay the fees. For this, the teachers are facing a great problem to maintain the family actually.
So far, Bangladesh has recorded about 790,500 cases of COVID-19, and nearly 12,400 people have succumbed to the disease. Many people like Mohammed Nemat Ullah are grappling with multiple COVID-19 deaths in their families. He lost 5 family members within a span of 2 weeks.
It happened in early April. Suddenly my grandfather developed a fever and a cough. We were surprised as he was always so careful and never ventured out without a mask. Then one by one, a few more of us started showing the symptoms, so we all decided to test. The first 4 or 5 days were not so bad, but then things took a turn for the worse. We had to take my grandfather to the hospital. We tried our best to save him, but he left us. My grandmother also became seriously ill, and the saddest part is, we couldn't inform her about her husband's death. Then my grandmother's son died, her daughter died, her daughter's husband also died. It was terrible.
Bangladesh recorded the highest daily new cases of 7,626 on April 7th and the highest number of deaths of 112 on April 19th. The government imposed a national lockdown on April 5th. This has now been extended till May 30th. Like other South Asian countries, Pakistan too is witnessing a surge in coronavirus infections. Mortality rates have been rising in Pakistan, and May 7th was the worst day in terms of COVID-19 deaths. Pakistan has a population of more than 200 million, and vaccination efforts are progressing slowly. The first batch of vaccines containing 500,000 doses of China's Sinopharm vaccine arrived in Pakistan on February 1st. enabling Pakistan to launch its vaccination drive a day later. So far, Pakistan has received over 13 million doses from China and the COVAX initiative.
The process to get registered for COVID-19 vaccination is easy in Pakistan. You need two things. First being the computerized national identification card, commonly known as the CNIC, and second being that of a mobile phone, the provision of a mobile phone. What one has to do is take out their mobile phones, send their 13-digit CNIC number to a special code at 1166. Then you would be getting back a specialized code, and from that code, you can just walk into a vaccination center and get yourself vaccinated.
Pakistan is one of the few countries to allow the private sector to import and sell vaccines. It has procured both Chinese and Russian vaccines to try and boost its vaccination program, having previously relied on donations.
Halls have been converted into vaccination centers so that more and more people can be accommodated. I'm standing at the Shehbaz Sharif Sports Complex in Rawalpindi, which has been converted into a vaccination center. The line behind me of the people are those who are willing to get themselves vaccinated or are there in the line to get themselves registered for the vaccination process.
In April, the Pakistan Army was deployed into cities to assist in enforcing coronavirus public safety restrictions, and the government decided to enforce a complete lockdown from May 8th to 15th in a bid to prevent a surge in COVID-19 cases during Eid al-Fitr, a holiday period. This was the most stringent restriction since a one-month lockdown in April 2020. Till now, Pakistan has recorded nearly 900,000 confirmed cases and around 20,300 people have lost their life to COVID-19. But there are many who are beating the virus. Meet Daneen Shabir, who lives in Islamabad. Her parents, Saima Shabir and Shabir Wahgra, tested positive a few weeks ago. While both of them were isolating in their home, 11-year-old Daneen had a tough time coping with the situation.
I have never been away from them like this, that we have been in the same house and we are unable to meet each other.
I just completely got shocked and fell straight into anxiety. And I kept on telling myself that this isn't true, nothing happened to him, relax.
While Saima and Shabir have recovered now, they feel their child will never be the same again. Like millions of children around the world, Daneen has been living in a world full of uncertainty, away from her friends and her school. Much like other Pakistanis, Daneen's family is hoping to get fully vaccinated soon. At the time of recording this report, only 0.6% of the country's total population had been fully vaccinated. This is Nepal. The second wave has been devastating for the Himalayan country, with a population of approximately 30 million. Since the outbreak began, Nepal has reported over 500,000 infections and 6,300 deaths. More worryingly, nearly 9,000 new cases are being reported every day, and the country is scrambling to secure COVID vaccines.
The daily coronavirus case load continues to increase in Nepal. Nepal as a country depends on its neighbor India for nearly all medical resources. And now that India itself is fighting the virus, there's a critical shortage of oxygen, ventilators and other medical equipment in Nepal. There are currently around only 1,100 ICU beds and 453 ventilators for its 30 million population. A new variant of coronavirus has also been detected in Nepal and will further be more challenging for the country to fight the pandemic.
The worsening outbreaks has swamped the country's fragile healthcare system. People are grappling with an oxygen shortage, and hospitals are running out of beds and ventilators. In fact, Nepal has requested mountain climbers coming back from their expeditions to bring back canisters for COVID-19 patients.
Almost half of the Nepal's coronavirus tests are coming back positive. Many relief groups in the nation are asking the mountain climbers to hand over their used oxygen cylinders so that they can be refilled and used for the COVID-19 patients. Nepal's healthcare system is on the brink of collapse as it is reporting over 9,000 coronavirus cases every day.
Let's hear what Gaurav Sharda, president of the Oxygen Industries Association of Nepal, has to say.
Currently, the demand is exceeding what we can supply. The government has asked us, all producers, to stop supplying oxygen gas to the industrial sector. So for the past 20 days, there are no industrial sales, and that sort of helped us mitigate some demand that the medical industry has.
The mountaineering expert has claimed that a coronavirus outbreak on Mount Everest has infected at least 100 climbers and support staff. However, Nepalese mountaineering officials have denied that the disease has spread to the world's highest peak. Nepal, which receives millions of dollars in income from climbers every year, issued 408 climbing permits for Everest for the April to May climbing season this year, after closing the peak last year due to the pandemic. The country is left with little choice but to brace for a crisis. Most countries in South Asia had managed to keep a handle on COVID-19 in 2020. But this year, facing exponential increases in case numbers, they are struggling with their COVID-19 responses. It is important to remember that the fight against coronavirus will not be won until every country in the world can control the disease.